Hello everyone, I'm Dr. Beatrice Hyppolite and this is your world. Can you discuss the ways in which unconscious shame or vulnerability may contribute to narcissistic behaviors?
That's quite common and prevalent in some ways. When a person feels that this thing that they're split off from themselves and they can't tolerate, that's in the shadow, and it makes them vulnerable and weak. If it's brought to them, right, shown to them, given to them, if they're exposed in a certain way, they may get into a narcissistic rage and they may want to destroy whoever shamed them. If it's an individual or if it's an entity, an organization, or so on, they would want to destroy that person in acting out their narcissistic rage because
So in a way they will be very vindictive.
could be violent.
And vindictive.
Vindictive and violent, vengeful. Is as if to say for them, it's like, why are you showing me this? Why are you showing me this part of myself that I disavow? Right? How dare you do this to me? I must destroy you. Because the narcissist operates at a place where he doesn't care for your humanity. He doesn't care for the fact if you have responsibilities or if you have emotions or so on. It is a lack of empathy, right? So he would want to destroy you.
To him or her, you don't
him
even
or her,
exist.
Him or her,
You don't even
whomever
exist.
the person is, right? They would want to destroy you if their vulnerability and shame is exposed. Yes.
For those type of people, whether that you drop dead, or what have you, that will not be even a concern to them.
No, it wouldn't be a concern to them. I give that example of the person with the split off part of themselves, right? That shame-filled part of themselves. Now, they were able to reclaim it, right? And to take back ownership of that part because they were given the space to do so and they had the emotional strength, right? To tolerate the reflection that was given to them. So part of the work is to help the individual to see that it's okay to be vulnerable. It's okay that you had this. It's terrifying, it's horrendous and so forth, but you did not die, right? You did not die, you survived it. And so that part makes it okay in a sense.
Andrew, would you say that it will be very challenging to work with those people? Because at the end of the day, you cannot work with them, you have to work for them. Because everything will be about them. And whatever that you do have to be around them. If you try to deviate yourself from what they want from you, then you will become an enemy. Am I right?
In part of the work dealing with patients, yes, I become the enemy for the patient in many ways. And some of it has to do with projection, right? Or transference. They transfer certain type of objects onto me and I have to hold it. And to hold their animosity and anger and rage and all those things, I am trained to hold that. And at the right moment in time, I give it back because it doesn't belong to me, right? They're giving me to hold and then I give it back.
But you will make sure that you know the right time to give it back.
Yes, as we were saying before, with clients knowing where the person is at and so on, so you give it back. Or just hold it until such time where they come and they want to collect it. They want to take it back from you. Now, someone who is a vulnerable narcissist, someone who is the perpetual victim, who could never do anything right, and so forth, who comes to therapy and wants the therapist to side with them, to align with that part of their pathology, right? That can be successful if the therapist is not skillful and aware. However, when it comes to my work with patients, okay, let's look at this together. And when I say, let's look at this together, I'm looking at you and looking at that and holding it and also showing it to you. Showing it to you in a way that is tender so that you can look at it with me together.
And don't feel that you are being judged.
And not to feel that you're being judged in the moment, right? But you're being supported.
Exactly.
The point is to get you out of that place of victimization, because where is the real power there for your life and your agency if you are using your victimhood to manipulate, to control, and to be a narcissistic personality? This comes back to what we're talking about in terms of healthy relationships and relating to others. You're not going to be able to do so if you're stuck in that place. So my role is to help you to see that truth. And one of the things that we do in the depth psychological frame is to look at the dream. Because I'm not just looking at what your ego is, I'm not just hearing what your ego is saying to me. I'm also looking at what the dream is communicating. What unconscious psyche is communicating here. And oftentimes what we find is that the dream also tells us what the solution is. So I give that back to the individual.
Okay.
Yeah.
My next question, how can individual use depth psychology principle to explore and address underlying shame or narcissistic tendencies?
Yeah. I would say going back to the first principle, which is confession. I also want to make this clear, which is for those persons who would have experienced a narcissistic wound and they are struggling from that wounded place, what they most need from us, those who are in the caring profession, is deep care and compassion, because they have experienced such, to some extent, such traumatic wounding that the psyche of that individual has been fragmented. So they need the care and tenderness, not in an enabling way, right? You want to engage in a caring and non-judgmental way as best as possible, understanding what is present in the session, what is happening. And that is looking at the wounding experience that the person has been, what they have had, right? So one, you're looking at, you're holding that frame, you're holding that place of compassion and deep care for the child that is wounded. This is not an adult that's in the room with you. It's someone, it's a child that's wounded, that is scared, that is fragmented, and is coming, genuinely coming to get healing, to have those parts of themselves reassembled, right? In a genuine way, they're doing that. For the person who is a narcissist, who is a malignant narcissist, they're not coming for that. They're not coming for that healing. They're coming to test power. They're coming to do some kind of thing that is not healing like, right? And thankfully, I have not had the experience with dealing with someone who is like that. So again, I'm saying this in a roundabout way. One of the feature would be confession, because as I said, in many ways that we need to know the truth. We need to be at a place where we take those stuff that are in the shadow and we bring it to light. Jung said that there is no coming to consciousness without pain and suffering. And so it's about bringing those things that are difficult, painful, right? Holding it together in the room with the patient in a way that they can tolerate the tension, right? So that they can get the healing. Yes.
What are the potential benefits and challenges of working with therapists who incorporate depth psychology principles in their approach to treating shame and narcissism?
Yes. What are the benefits? one, you will get the truth. You'll get the truth in the sense that you wouldn't get BS. You'll get depth. You'll get appropriate holding, right? You'll get a reflection. You'll get the ability to model what is an appropriate therapeutic relationship, right? You'll get understanding of the need to be in a space of holding the tension of the opposite and be in paradox. You'll get ways of thinking and being that is expansive because you are not just one thing, you are many things, right? And you experience various states of being. So you'll get all of that. And the trust and the hope of it is when you leave the depth psychological or Jungian analysis, you are able to engage in life in a way that is fulfilling and meaningful to you, your community, and those who you love and care for. That's what you'll get.
Okay, so is there anything you want to add to your presentation? I know that you had 2 books that you wanted to talk about.
Yes.
So what else you have for us?
Yes. So aside from the DSM, one of the other diagnostic guide that I use is the psychoanalytic diagnosis. It's in the 2nd edition. And this is by Nancy McWilliams. This talks about how to understand personality structure in a clinical setting. Not the narcissistic personality as outlined in the DSM, but the structure of the personality that is that needs work, right? And this is just for information purposes. The Underside of Narcissism, this is by Andrew P. Morrison. And so this helps us to understand a little bit more about how narcissism is framed from a shame approach, right? It shows us that. A lot of the literature out there does not really look at shame and how it informs narcissistic behaviors, right?
So tell me a little bit about the importance of it, since you mentioned it.
Yes, because the narcissistic personality has skipped a developmental step, that they're stuck, right? They're stuck in this space as a toddler or a 4-year-old or so. They are in that place of trying to...
But that stage, we don't know which one.
You don't know exactly which stage it is, but they're stuck. They're stuck in that stage. They're not an adult, right? Person's still a child. And so what you want to know is to find out a little bit more about what was it about this person's life as a child that is so wounding to them that got them in that place where they're so stuck.
Throughout the therapeutic session, will you try to understand which stage that was lacked?
Yes,
okay.
Yes. While I'm working, I'm tracking, right? I'm using all of these theories, Erikson, Piaget, the behavioralists. I'm using Jung and Freud.
Because now you are conducting a throughout investigation.
Yes. So I'm tracking all of these things and I'm looking to see where the person is at. But what I rely on heavily is the dream, because the dream gives me more data that is coming directly from the individual, bypasses the ego, right? The dream is not dressing up the content to please me, right? It's giving us in the work the direct truth about what's happening. So I look at that too to see what's going on at the intrapsychic level. So it's important. It is important for those who are in the profession to look in the person's personality structure to see where shame exists, right? And where toxic and neurotic shame exists.
Okay.
Yeah.
Is this your final print?
Yes, this is my final print. Thank you very much for having me. I'm looking forward to returning again sometime soon. It's been a long day. It's been a very, very long day, and I'm just looking forward to having a wonderful evening. And For anyone who's interested in working with me or learning more about my practice, it's Ariel Counseling and Wellness. We are on Psychology Today. Just use my name, Andreau Charles. Our telephone number is 917-905-4563. And our email address is info@Ariel Counseling and Wellness. You can Google us, you can give us a call, send us an email, and let's see if we are a good fit to address your needs and concerns.
Or in case you may not remember his phone number or the email, just go, subscribe to the channel and shoot me a text and I'll contact him on your behalf.
Yes, that's also an option. Yeah.
It was a great pleasure to have you.
Yes.
And I must thank you so very much, because when I called you and I said, I need us to meet.
Yes.
And so without even thinking twice, you said, oh, let's meet on that date.
Yes. Yes.
And I really appreciate that.
Yeah.
So, I don't need to invite you. It's whenever you feel like, having, talking about a subject, just call me.
Okay.
And we'll make arrangement.
Okay. All right. Thank you.
Keep on looking good. Because,
I look good. You look fantastic.
No. You know what? Of that said, let everybody go. It was with you, Dr. Beatrice Hyppolite, with your world.